All right. So before we get started, welcome everyone. I'm so excited to kick off the second session of our Redesigning Maternal Health series. Today we'll be focusing on prioritizing doula well-being. Next slide, please. Before we get going, I just want to review some housekeeping. One, no AI note takers are permitted to be in our
Mm.
space. If you need closed captioning, please click the icon at the bottom of your screen. Feel free to use the Zoom Q&A question and function during our conversation today to ask questions. This webinar also will be recorded and shared with folks if you were unable to attend today. And I encourage you all, once you receive those materials, to please share them in your network. Last but not least, we may have some polls throughout today's webinar. Feel free to engage if you need those. And at the end of our webinar today, we'll be launching a poll and evaluation survey. It's so important that you take the time to complete the evaluation survey because that helps us inform our next webinar series, session, and topic. All right. I think that is all my housekeeping. Who we are. Again, as I stated, for those who are just joining us, I'm Stephanie Campbell. I'll be your moderator today. Health Leads is a national nonprofit. We were founded in 1996. We work locally and nationally to remove deep-rooted systemic barriers to health, center power and resources within communities, and build a world where racial health equity is the standard. Our vision is health, well-being, and dignity for every person in every community. And the way that we do our work is we partner with communities and health systems to address systemic causes of inequity and disease. We do this by removing barriers that keep people from identifying, assessing, and choosing the resources everyone needs to be healthy. Next slide, please. With the way that we do our work at Healthleys, there are four strategic levers: shared power and decision making, community investment and learning, equitable data and measurement, sustainable care and care workers sustainability. Sustainable caregiving is a continuous thread amongst all of our Healthleys initiatives and critical to today's discussion. Doulas are an integral part of the care workforce. Sustainability, as I said, is a pillar of our work, and we appreciate the impact that care workers like doulas have on maternal health outcomes. What's important and unique about today's conversation, we are raising up and amplifying work around who is caring for care workers. Today, we'll explore equitable wage and benefits. We'll talk a little about integration and collaboration into clinical care teams and care worker well-being. We know that care workers, particularly our doulas, are closest to the communities that they serve, and they are at risk and being constantly exposed to vicarious trauma and burnout. And one way in our work that we've addressed this in Health Leads, as many of you know, Health Leads is the backbone organization for the New York City Doula Coalition Access. We've created healing spaces for our doulas to have an opportunity to connect, to prevent burnout, talk about some of their strategies. We'll share the link to that piece so you can learn more about the healing space in the chat. Our agenda for today, we're going to look at building communities with and for doulas. We'll hear from Brandie Bishop. We'll talk about prioritizing doula mental health. Dr. Hutchinson. We'll also have Chanel Stryker talking about advocating for doula well-being overall. In addition to our conversation today, as I stated earlier, I'll be your moderator for our conversation. Next slide, please. I want to do some level setting to make sure we're all on the same page. The definition that we'll be using today to describe doula is doulas. A doula is a trained birth specialist who offers various culturally sensitive services, which may include ongoing physical, emotional, spiritual, and informational support to clients and their families before, during, and after childbirth. Doulas help their clients prepare for birth and advocate for their wishes, encourage them to take the active role in their pregnancy journey, and assist them with their transition to parenthood. Many of you all on the call may be doulas, and doulas are a special place in my heart. I have shared with many of you, even in preparation for this webinar, my doula was a key part of my birth team. And so you are near and dear to me, and I'm so excited to be exploring this topic because the work of doulas is deeply meaningful and often spiritual, but emotionally, physically, and financially demanding. And in recent years, there's been a real recognition of the vital role that doulas play in improving birth outcomes and reducing disparities for Black, Indigenous, and other women. And with that being said, I'm going to transition us to our first speaker, Brandie Bishop, to share a little bit more about how she is building community with and for doulas.
Hello, everyone. How are you? Thank you so much, Steph, for introducing and for getting us kicked off this morning or afternoon, depending on where you are in the world. As Steph said, my name is Brandie Bishop. I am the CEO and owner of the National Black Doulas Association. And it is my pleasure to be able to speak with you all today about what you can only imagine is near and dear to my heart, which is doula work. I have had the pleasure and honor of being a doula for about 15 years now. I've attended well over 300 births. And when I first started off in birth work, I actually worked for a refugee resettlement agency. And so I was able to start off my career path working with people from so many different parts of the world. And it really cemented my love and respect for the transition into parenthood for our birthers and for their partners. And so I tell people all the time when it comes to talking about community, sustainability, and just a career model that can be seen within the birth work world, I feel like I can be the poster child for that because one of the little known facts or things that I like to share with people is that I actually have never birthed a child myself. I am one of those people who wanted to be a part of this birth work space, not necessarily because of a personal scenario experience for me birthing myself, but because I have such a deep respect and love for the space. And I think that speaking about community, it's important for us to acknowledge that everybody who comes into this space as a birth worker might not do so because of their own pre-existing birth trauma. Now, if you do, I think that that's, more hats off because, and this often happens, right, within Black and Brown communities where we see something that wronged us or affected us negatively. And as Black and Brown women, we oftentimes take up that mantle to say, I don't want anybody to experience that, right? But there's also a place within this birth work community for people who do this as a career. And I think that speaking about community gives us the ability to really share what are other people doing outside of being a doula, because oftentimes we see those jobs as careers, whereas oftentimes we don't see being a doula as a career decision. And I, for one, think that it's a wonderful career path, right? And so talking about community, when we talk about like, what is the birth work community? Who's a part of this community, right? I tell people all the time that one of the things that I love about being a doula is that it challenges you. There are so many investments that you make emotionally and spiritually, but it also stretches you as a person. And I am one of those people who loves to talk, right? You guys will get a good feel of that as we go along here. But I'm also someone who loves to make connections. And being a part of the birth work community has allowed me to really stretch that muscle because community is not just important for the doula, right? Doulas need community. Don't get me wrong. We do not want to be an island out here. But during our trainings at the NBDA, I often share that community is not just for you, it's for your birthers. It makes Black and Brown birthers feel safe when you have a community of people that you can refer them to, right? And so when we're building community, we need to be strategic and we need to make sure that we're not just doing it for ourselves, but we're doing it for the birthers that we'll support. And so when I first became a doula, I remember one of the first pieces of community that I started to build was with some of the midwives in my local area. And that's important for a lot of different reasons. One, there's a ton of wisdom there, right? As a doula, I think that I've found for most doulas, we're lifelong learners. learners. We love to learn. We love to be a part of a training. We love to sharpen our skill set, which I love. But another way to do that is to get under wisdom. And I think that building your community and starting in a place of wisdom is a great place to begin, right? So talking to some of the midwives in my area about their experiences and how they found working with clients within our community work best. What are some of the things that I should know? That's a great place to start when you're building community, right? Going on from there, you want to look at what is your community telling you that they need, right? So when I was looking to build community, I didn't just look at, okay, what are the things near to me, but what does my community actually need? As you work with clientele, you want to build out your community of other birth workers based on what you know is a need for the clients you're serving. For example, within the Black and brown birth space, when I met or would start to meet with some families for the first time, chiropractic care is not something that everybody was like used to hearing when it comes to birth. They're like, well, why would I have a chiropractor if I'm looking to have a baby? Those two things don't always make, add up to people. And so when you're a birth worker, specifically a doula, and you're introducing some new ideas and strategies when it comes to birth, because that's a lot of what we do. We're here to educate our community, educate them on their resources and what they have the ability to attain during their pregnancy. And I think with that community piece allows us to further that education, right? So if I know a really great chiropractor that I can send families to that will not only, help with their care, but educate them on why it's important. What are some of the benefits to chiropractic care during my pregnancy? The same thing for like pelvic floor therapists. When you talk to a lot of birthers in general, and very specifically Black and brown birthers, we might have never heard the term pelvic floor therapy. We might not know anybody within our close friend group who's heard this term, let alone be able to pick one out that would be good to help us during our postpartum period, right? So as a doula, that community building is definitely for you, but also for your birthers at large. Now, when it comes to what that community looks like for you and why it's important, that's probably more so my passion, right? As the CEO and owner of the MBDA, I tell people all the time that my focus has shifted from babies and birthers to doulas. All I care about is doulas. How do we get doulas better pay? How do we make sure that doulas are having a more sustainable career? How do we make sure that we have places to vent and to share our experiences? How are we making sure that these hospital systems or various places around the US are being more receptive to us, right? That is my job now. Now I get to make sure that the doulas are my babies. They're well taken care of. And the way that I know, because I've been a doula for a very long time, how I know that I'm best taken care of is when I can take care of my bills and my needs, right? Oftentimes, as doulas, we look at the sacrifice and what's needed for our clients, and that's so commendable. Like, I just think that that's a part of being a doula, right? We are typically very empathetic and sympathetic people. We don't want anybody who needs a doula to go without a doula. We want to make sure that our sisters, our friends, our cousins are getting the type of care that they deserve at such a vulnerable time in their lives. But oftentimes we do that at the detriment of ourselves. We will say, oh, I'll do this for free, or I'll do this at a low cost. And I tell people all the time that while being a doula can be something you need to do in a way that's strategic, depending on what your income level you want to have from that. It's not something that you have to do in a way that you don't benefit at all. Any job, people are doctors, lawyers, these people help people, but they also get paid really well to help people, right? And so it's not, I feel like oftentimes we feel as if, as a doula, if I'm charging or if I'm being paid adequately for my services, I somehow am making my community suffer. But the reality is that communities need this help and they need you to be around to do it for years to come. One of the things that we're really up against within the birth workspace for Black and brown doulas is longevity. We don't have very many doulas who make it past 1, 2 years. And what that means is we're losing so much wisdom. So many doulas come into this space and they're excited and they're ready, but then they can't make it make financial sense. So they leave the space with all of their skills, with all of the wisdom that they would have brought, with all of the protection that they could have brought to birthers, right? So it's really incumbent on us that we don't only see us working within our community as a sacrifice, but we also see it as a way for us to be able to stabilize our finances as well, so we can continue that work for 5, 10, 15 years. There's no reason why somebody that's been a doula for 5 years should feel like, oh, I'm an OG, I've been out here a long time. That should be, oh, you're getting your feet wet, you're really getting into the work. But if you look at the statistics, that is honestly a very long tenure for a Black doula to be able to do it, especially full time, and make money doing it for more than 2 to 5 years, right? So community building is important because it helps us with the sustainability. One of the first things I did from a marketing and business standpoint when I first became a doula is, instead of trying to find one client, I was like, where all the pregnant people going? Where they at? Because I want to, get to that particular place, so I don't have to, look at one person at a time, but instead I can spread that out. And so I started to go to WIC offices, go to pediatricians, go to, so the way that you market and present yourself to your community is just as important when you're building that community, right? You don't want to just be out here and nobody knows that you're out here. Nobody even knows how to become a client of yours if they wanted to, right? You have to make sure you set up your business in such a way that people who want to be your clients are able to access you, but also that your community knows that you're there and you're a resource. Many of the clients that I've gotten over time, I'll be honest with you, have been through word of mouth, not necessarily just from other clients, but from other birth workers, right? When you build your community, if I have a chiropractor that I refer to because I know that their work is good, they're going to refer clients back to me. That's a part of community. Community takes care of one another, right? So I just want to make sure that as birth workers, we're not only viewing community as a sacrifice, I'm doing this for my community, but also understanding that your community will feed you as well. I tell everybody, I don't become the CEO of the NBDA if I don't have every single Black and brown birth worker that has helped me, that has championed me, that has been a part of my community, right? And what that's meant is that they have sent referrals my way, that I've sent referrals to them, that we've talked about price points, that we've discussed what's best for the market, not just what's best for us individually, right? And that's community. That allows us to do right by our birthers and protect them and be the advocates that they need and they deserve. But it also allows us to sleep well at night and get a massage from time to time. And so I think the community is one of those things where we, in general, as a community here at the NBDA, are looking at making that equal side on both sides, making it equal, where our birthers have a sense of safety when it comes to community, that they know the people we're referring them to are people that are going to take good care of them, that we vetted them, that we have relationships with these people. But then on the other side, that we have that sustainability because we've taken the time to strategically build out our community, so it also filters back into our businesses. I think I answered a lot of questions. I did not do them individually, Steph, but are there any other questions you want me to make sure I cover?
I
I
think
get a little passionate.
appreciate your passion, and I think you hit on so many great points. That I think we're good. I feel like you have covered everything for now. I encourage you all to use the Q&A function if you have additional questions for Brandie as we get to our moderated discussion after we hear from our additional two speakers. Thank you so much, Brandie.
Thank you.
And I am going to transition us into our next speaker. It is my pleasure to turn over our discussion to Dr. Hutchinson and her colleague, Carrie Ann, who will be joining her as well, and talking about the work that they're doing at the Journey Institute. The floor is yours, Dr. Hutchinson.
Thank you, Stephanie. Thank you guys for joining us today. We just heard this beautiful passion about why doula sustainability is needed. So hopefully my topic today will talk about how do we refill doula's cup to make sure that we're actually creating this pipeline of sustainability for them. Next slide. So just a little bit about the Journey Institute. Our mission is about empowering families with evidence-based, culturally sensitive support to really foster resilience and strong parent-child connection. And it's all about creating that thriving future where children from birth to age 5 really flourish in nurturing families and strengthen the parent-child relationship with bonds for life. That's where doula comes in, because doula bear witness to the birth of new life. Next slide. Before we get started, to actually set the tone for our session, our time today, we're just gonna engage you in a brief mindfulness to just get grounded to really be here in the present. The reason why we start with a mindfulness, because one of the things there's this famous quote in the infant mental health work: you cannot really pour from an empty cup. And what that's saying is it's more than a powerful reminder that as doulas, what you need to do is to make sure your emotional, your spiritual, and mental health being matters. And by creating those healing spaces for yourself, you're also realizing that it's not an option. This is something that you really need to be intentional about. So to really support others, especially during those vulnerable moments of birth, that you really must also tend to your soul, your spirit, and your mind. Caring for the healers, how we sustain this sacred work as we do this work. Next. So what is the vision behind the Hearts of the Healer, our program? The Hearts of the Healer was born out of our deep work alongside doulas, where we recognized the urgent need of to center wellness, to really instill and sustain a pipeline of doula. But more importantly, to really ground that wellness in a trauma-informed space is also needed by utilizing a trauma-informed approach. Doulas just don't support birth people. They also carry their own stories, like Brandie said. They carry their own stories, their own wounds. And the sacred work of supporting birth people can also stir up those emotions, those unspoken reminders. That's why it's really critical for doulas to have reflective healing spaces to really process those emotional toll of the work and to really continue to showing up with clarity, compassion, and care as they do this work to support birthing people. Next. So we're asking, why doula reflective supervision? Reflective supervision is vital for a doula because this work carries deep emotional labor, and it also carries the weight of vicarious trauma. And bear in mind that while mentorship offers guidance for doula, because I know a lot of you doulas are receiving mentorship, but it often creates space to sit with discomfort of the emotion that surfaces. Reflective supervision, on the other hand, invites doula to really lean into curiosity, to explore their deeper wounds, and to reflect alongside their peers. It's a supportive space to really bear witness to one another's experiences and to sustain healing, and also to strengthen the heart of their calling. Next. Next slide. So on this slide, you see reflective supervision for a doula is also a relationship-based framework of intentional practice that really offers a safe space and a brave space to really explore those emotions and the reaction that might arise from the deeply personal nature of birth work. It also supports emotional regulation and helps doulas to process moments that may trigger their own wound, especially after challenging experience like a birth trauma or a loss, right? So when question like what I noticed, doula will be faced with question like, am I good enough? Those questions will begin to surface. So that space in the reflective space really allows doula to share their vulnerability about what that experience was like. And through reflective supervision, we also model how to sit with discomfort and use reflective questions to really better understand a mother's experience. For example, when supporting a mother with a history of traumatic birth, acknowledging her fear with compassion can also shift our perception and also reduce the anxiety and the positively impact that birth outcomes. So this work is not just about holding space for others, it's about learning how to hold space for ourselves too. Next slide. So here are the components of our initiative. As part of our initiative, we began with an informational session to introduce doulas to the concept of reflective supervision, which is an approach many have not heard before. And while most are familiar with mentorship, they quickly became curious about reflective supervision because they've never been introduced to that standard part of as part of their doula training. So during those conversations, it also became clear that many doulas were also carrying the emotional weight of negative birth outcomes. And this basically highlights highlighted the urgent need to really strengthen the doula workforce through trauma-informed reflective lens, really that builds emotional capacity, reduces burnout, and promotes long-term sustainability in the work. So in response to all of that at the informational session, we offered a 2-day, 3-hour training designed to really introduce reflective supervision to the doulas through a trauma-informed framework. So then doulas also completed pre and post test training surveys to really assess their understanding. And then afterward, we began engaging monthly 90 minutes reflective supervision circles. We emphasize also the idea of predictability in attendance, not only to build trust with the group, but also to model the kind of steady relationship-based support doulas are encouraged to really provide to birthing families. So this initiative is also aligned with the Infant Mental Health Endorsement System, which is a nationally recognized competency-based framework for supporting best practices for professional working with birth to 5 population. So by the end of the program, participating doulas will be eligible for endorsement at the infant mental health specialist level, elevating their professional credentials with a system that is also recognized across 38 states, including New York and Massachusetts, where some of you guys are, but also 3 international countries. So the work is not just about supporting doulas, it's about transforming the way we care for those who care for others. So through reflective practice and supervision, we're also investing in healing growth and excellence in doula workforce to really build doula competency and also build their credential and system. Next slide. So what we did did a pre and post to really capture the doula's knowledge of what they know about doula, and we also used it to strengthen the capacity of the program. Next slide. I just did that. Next slide. Like I said before, we did the pre and post. And then the reflective supervision scale, we created a reflective supervision scale for doula we use that scale to assess their emotional wellness and their capacity for self-regulation and trauma triggers to better understand the emotional toll of their work. So we do that initially at pre, and then at midpoint, about 6 months mark, we also do our re-eval to see their growth. And then at 12 months point, what we plan to do is a final post-assessment to really measure the overall impact of their engagement in reflective supervision circles and the integration of the skills into their practice that they do with supporting the birthing people. Next. Part of the component, this screening was extremely critical to the work that we do. We administered the Adverse Childhood Experience Questionnaire, which is a tool for doula to understand how their own trauma might trigger or show up in the birthing person's experience, right? And also, it allows them to recognize that trauma-informed care starts with provider stories. So as doula, it's also important to know your own number and to get a better understanding when the birthing experience evokes reminder. So Adverse Childhood Experience is a really questionnaire, talks about our early childhood experience between the ages of 0 to 18 and how we've been exposed to negative adversity and how that impacts the way we show up in relationship. Next component. Next slide. And then a part of the components of the program is storytelling. We integrated storytelling where there is a clinician in the reflective circle, really capturing the storytelling component to gather the qualitative part to really help us understand the lived experience of the doula. So by capturing their stories, we also aim to elevate themes for advocacy learning and also increase awareness around the emotional realities of their work. Also, keep in mind that while storytelling can be a powerful tool for healing, it can also surface pain, making it really essential to provide safe space for doulas to share and also to reflect on and unpack their experiences without harm. Next. So we also recognize that doulas bear witness to trauma and loss, like Brandie said, right? They also are holding space for the systemic inequities that birthing mothers experience and their own individual experience as doula in terms of access to hospital when supporting the birthing people. And all of these things actually lead to emotional exhaustion and burnout. Maybe these are also some of the issue why you're also seeing doula attrition. So we recognize that reflective supervision is really a necessary bomb. Next. So what are some of the outcomes we're open? We're open that this framework will serve as a model for integrating reflective supervision into all doula training programs with the goal of building a more sustainable an emotionally supportive doula workforce. Our vision is that doula will begin to advocate for the inclusion of this practice in their training, recognizing the role of strengthening emotional resilience and that reflective practice has the potential to really serve as a powerful protective factor against burnout and vicarious trauma. So some programs in California already begun integrating reflective practice and infant mental health principles into the doula training, an approach we believe really should be adopted broadly across the country. Next. So we think about reflective practice, not just the tool, it's the heartbeat. Reflective supervision is not just the tool, it's the heartbeat of sustainability, impactful birth work. It also creates emotional space doulas need to process, reflect, and grow. And it also allows them to show up fully for birthing people while also honoring their own humanity. So when we care for the hearts of the doula, we also strengthen the entire birth experience. I think that's it. Question. Thank you guys for having me today. Any questions? I don't think.
Thank you so much, Dr. Hutchinson. Like I was over here quickly writing what you said because it really resonated with me. The caring for the heart of the doula is really like caring for the heart of the community and the birth person. So
Mhm.
that was my delay, y'all. I was trying to capture that powerful quote. Um, it is my pleasure. Thank you, Dr. Hutchinson. We're going to save all questions to the end so we can really take a deep dive and give everyone adequate time to answer them. So it is my pleasure now to transition us over and welcome Chanel Stryker, co-founder of the Georgia Doula Community Access Coalition. Ha ha ha. I just jacked up that acronym. Let me get it right for you. It's the Georgia Community Doula Coalition. Y'all doulas, I love y'all, but y'all coalitions, y'all all got access to coalition, and now I'm starting to mix them up. But anywho, thank you so much, Chanel. Welcome to the stage. The floor is yours.
Hello, good afternoon now, everyone. As Stephanie shared, my name is Chanel Stryker. I am the co-founder and executive director of the Georgia Community Doula Coalition. Are we going to put the slides up, Stephanie, or should I? Okay, thank you. Okay, awesome. So I am going to be talking about advocating for the well-being of doulas and about the Georgia Community Doula Coalition. Next slide, please. So the Georgia Community Doula Coalition, our mission is a Georgia where we're dedicated to improving birth outcomes and advancing culturally sensitive perinatal health care across Georgia by ensuring equitable access to community-based doula services. Our vision is a Georgia where all families have access to culturally rooted doula care and community doulas are respected, paid fairly, and central to equitable birth outcomes. I am a community-based doula. I didn't share that before. I have been a community-based doula in the state of Georgia for the last 5 years full-time. But as a lot of us who come into this work, we've been caretakers and doulas for as long as we had words to put to what our roles were. So I have a deep knowledge and livable experience in supporting families and community through doula work. Outside of that, I am a mother. I have 3 of my own children. And of course, those birth experiences did help to bring me into this work and understand the holistic understanding of why doulas are important. I'm so sorry, Nadia. I wish I could speak slower. I talk a little bit fast, so I do apologize. I'll try to be mindful of that. So at the Georgia Community Doula Coalition, we advocate for the well-being of doulas, but outside of the well-being of doulas, we advocate for the sustainability of doulas as well. So we say thriving, sustainable, livable wages, because livable wages and what they identify that on a policy, federal, governmental level is just being able to maybe buy your groceries and things like that. But as Brandie shared when she was speaking, doulas need to be, we are essential workers, right? There have been claims that doulas are the answer to the maternal health crisis. And like I always say, for invaluable work like that, doulas should be paid at an equitable, sustainable rate beyond what is happening now. So you do have a lot of doulas that still provide support for free and a very low reimbursement rates. And it is even on a state level or even a federal level, they have recommended that doulas are reimbursed at $3,000 per birth, but in a lot of places, they're still only reimbursed at 500, 750, $1,000. And if you think about that, that means that doulas have to support 5 to 6 clients a month in order to be able to maybe even take care of themselves. And that is a huge no in our practice to have that many clients, because you have to provide such comprehensive full spectrum support to everyone. And if you're supporting that many people at once, you can't extend yourself. And that's where that burnout comes in. That's where unintentionally harm is being created, as Dr. Harleen Hutchinson was sharing, where that vicarious trauma and that harm is being poured into the families because we are not able to take care of ourselves, right? Or be able to show up fully because we're not able to sustain ourselves. So we advocate at the Georgia Community Doula Coalition for fair compensation for doula services. We want autonomy in training pathways. And so what that looks like is some organizations or some community-based programs and things like that, even on a legislative level, will say that you have to be trained by a certain organization in order to be reimbursed, and that causes issues of exclusion and gatekeeping, because doulas don't even have to be trained. I like to share that all the time. This is not yet an allied health profession or a role that is there's no clinical parts to it. It is more so just a support for the family. We are now where we are because Black and Brown people, are dying in childbirth, right? And so doulas have to know how to advocate, and they have to have these certain skill sets. However, this role ancestrally and traditionally was just your mom, your friend, your sister, your aunt, your cousin, right? And we were just the hand holders for moms as they go into having their babies. So some people have gone through apprenticeship models to become a doula, or they may not have been trained. This is just the support that they've provided to their community as a community healer. And so they may not have formal doula training. So it excludes a large group, especially of Black and Brown birth workers, when there are certain training organizations that are being said are the only ones that they will accept or be able to get reimbursed. So we want doulas to have autonomy in their training. We want them to have choice in if they certify or not. You have a lot of doulas. I will give an example for myself. I trained with DONA International, which is a large doula training organization in the United States. However, I decided not to certify with that organization. And I had that right, to not certify, to either certify with another organization or not certify at all. But it doesn't mean that I didn't receive the training that was necessary to do the work. We also have advocate for freedom to work on our own terms. Again, this is ancestral work, traditional work. And so a lot of doulas sometimes don't want to be integrated into hospital systems or into any systems at all, whether it's being reimbursed by community-based doula organizations or even receiving reimbursement. Some doulas don't want to receive insurance reimbursement. And so we want to advocate for those people as well. Freedom to self-identify. The history behind the word doula, if you look it up, it means female slave. And so there are some doulas who do not like to be called doulas. They would like to be called a birth keeper or a birth attendant, or there's so many different terms out there for what doulas identify as. And so we want to make sure that they are able to do that and still be included in the full landscape of doulas. We do want doulas to be able to opt in and out of registries. So right now in this country, there are a lot of organizations such as my own who are creating these registries for doulas to be put on to be able to get reimbursed across the state. And in some places, you have to, if you are a doula, you have to be signed up to these registries. Again, for something that is ancestral and traditional and holistic, some birth workers do not want to have to be a part of these registries. So we advocate for doulas to be able to opt in or out of that. We want to honor the holistic modalities. I think I've spoken enough about the deeply rooted, traditional ways that this work is and shows up. And so we want them to be able to practice in the ways that feel best to them and utilize whatever their traditional practices are. We also want barrier-free access to continuing education. So like Brandie was saying, doulas take all kinds of training, very knowledgeable people, but those trainings can be very expensive. For example, to become a certified breastfeeding specialist, it's upwards of a couple of thousands of dollars. To take spinning babies trainings could be hundreds of dollars. And for people who, especially community-based doulas, who are of and from their communities, they don't have the funds to be able to pay for these trainings, because also this is not an allied health profession and there are not technical CEUs attached to this. A lot of these trainings are not covered by any, and doulas don't work for organizations, a lot of them, right? So they're having to pay these things out of pocket, and they can be very expensive. So we want to be able to provide that barrier-free access, either low cost or barrier-free. We want doulas to have a choice in how they're reimbursed. So whether they want to be reimbursed private pay, or they want to be reimbursed through community-based programs, or they want to be reimbursed by insurance, we want them to have the choice in that. We do want to include doulas in legislative policy that's in relation to maternal health, birth justice, and doulas. A lot of times you have these policies and things that are moved forward, and you don't have the people who are doing the work and directly working with the community involved in making those decisions. And so we want to make sure that doulas' voices are heard, because they matter and they're very important in this work. We want to also advocate for protection from exploitation. So, as I shared before, it has been said that doulas are the answer to the maternal health crisis. That's not true. It wasn't a crisis that was created by doulas, and doulas are, again, this role was not created in the way that it is now. We're happy for where we are, but this is not what it essentially was supposed to be. Doulas are just, again, your friend, your cousin, family member who are supporting, want to hold mom's hand as she's walking through the birth journey. However, doulas are utilized in a lot of systems, even sometimes your hospitals, community-based organizations, as the thought leaders, as the, answer to whatever's happening in those systems and the resolution. And that is a heavy burden to carry. And that also contributes to the well-being challenges and the burnout rate. And we also want doulas to have the autonomy to remain independent. So all of this that we've shared, integrating into hospitals, integrating into the, healthcare system and all of the things, some doulas don't want to do that. They just want to continue to maintain the ancestral practice that doula work is. And we want to advocate for doulas who want to do that, because it's okay. So why is mentorship important? Mentorship, and if you look here, this is our mentor, Shakana Haley. That's why I shared this picture. She has mentored countless doulas across the country, and she has a vast network of birth workers. You can't go anywhere and not find someone who was trained or mentored by Shakana. And so we have a huge network there, but it's something that's deeply embedded in the work that I do and what we want to offer through the Georgia Community Doula Coalition. As I think Dr. Hutchinson and Brandie have shared, it's extremely important that doulas as well have community. To build confidence, reduce isolation, just having a place to go and share some of those experiences and some of that vicarious trauma that they're experiencing, to have a place to kind of like, not dump it, but to process it in community with other people who understand what they do. This work is very unique. And a lot of times when we're doing it, other people don't even understand. Our family members, our immediate family, our friends don't really understand why we have to show up in the way that we do and why we do what we do. So having mentorship and mentorship circles is extremely important for doulas. This addresses the doula holistically. I'm hoping that mentorship is also addressing the mental health of birth workers. Something that I shared in a training that I was doing for hospital providers recently is that birth workers are a lot of times, just as much as I'm sure healthcare professionals struggle with mental health challenges and physical health challenges, because they carry a lot of the burden. Again, especially community-based doulas who are experiencing the same social determinants of health a lot of times as their clients, or who have experienced their own birth traumas, family traumas, things like that, that even brought them into this essential work. Sometimes those things aren't addressed prior to coming into doing this. And just as much as we can receive traumas from the system, again, we can be putting trauma on others and receiving trauma on ourselves if we haven't addressed these challenges. So Brandie talked about earlier how there are doulas who come into this work. A lot of time, Black and brown doulas come into this work because of the traumas that they have experienced. But in order to support from a trauma-informed lens, you have to address your own traumas first. So I loved what Dr. Hutchinson was saying, because when I teach trauma-informed care, I teach it from a place of healing your own trauma before you can help anyone else to navigate healing through their own. We also have a huge savior complex in this work. Again, something that I think shows up in healthcare in general, right? And we are not saviors. We're not here to save anyone. We're here to empower others to save themselves, right? And because birth is such a sacred journey that you have to navigate on your own anyway, that we can't think that we're going to come in and be the ones. But when you've seen so much, and you've experienced so much on your own, and your mom, your sister, whomever else, and you have this generational trauma that you're carrying with you, it's innate, it happens. Even myself have had to go through my own journey of removing the savior complex from this work that I do, and understanding that I cannot save anyone. And in my early days as a doula, I would be so sad, go home crying, and after births just be full of rage and anger, because I'm like, there's so many things were happening. I just want to fix it all. But that is not what we're here to do. Right. So mentorship is really important to help doulas understand how they can show up, and not from a disconnected or dissociative way, but how to be able to support without taking on all of what is comes with your clients and the families that you support. And then encouraging the retention and leadership of doulas. Like Brandie said, you don't get doulas staying around for very long. And what I'm seeing happening now is they're like, I'm gonna go from being a doula to being a midwife, because being a midwife, I can get paid more. But that's that's not the answer. That's not the answer. We need doulas just as much as we need midwives, and we need everyone to be in the places that they're in to support the families holistically. So we want to keep doulas being doulas. We want doulas to go from doing what they do to also educating other doulas once they get to a place where they've learned and advanced, so that we can train more doulas in our states and in our communities. And this, again, like I said before, this work is used to be passed down. It was done in an apprenticeship way. If we don't have any more doulas left, then our next generation isn't going to have doulas, right? So we want to keep the profession alive. We also need doulas in leadership spaces. So in order to be in those spaces, you need mentors like a Shakana Haley, who has a vast network of maternal and child health professionals that they know and are in community with, to be able to, for example, my first job at Healthy Mothers, Healthy Babies in 2022, it was because Shakana knew the then executive director, and all I did was talked. I was a regular just doula, right? And I said some things at a in-person session that we had, and she saw the value in what the knowledge that I was able to bring, and I was able to help to integrate doulas in the state of Georgia into our maternal and child health workforce system. And so now you have a lot of doulas, not a lot, but you do have doulas working in the maternal and child health system across the country, but especially in Georgia, where it helps to also booster the workforce and the sustainability of doulas. But because of that work, if we're able to be paid and work a full-time job, then we can pour more into our communities and support the families better. So what does action look like, or advocacy look like in action for sustainable and livable wages for doulas? So we hosted Community Doula Day at our Georgia State Capitol in the beginning of this year in March, during Community-Based Doula Week. And we were advocating that day for Medicaid and private insurance reimbursement, and for doulas to be recognized on a professional level in the state. Right now, and I can only speak for Georgia, which I'm sure is common, in other states, especially in the Southeast. But in Georgia, doulas are not, our legislators don't even know what a doula is. They don't really know the difference between a doula and a midwife, and doulas are not recognized on a state level. So because of that, we do not have Medicaid reimbursement, and private insurance reimbursement is really difficult to get, because doulas have to understand the nuances of super billing, and they have to have an MPI number, or they have to get their clients have to know how to get reimbursed from their insurance providers after they provide the support. And so we wanted to just be a seamless process where doulas are able to be reimbursed by Medicaid, and that the state says that Medicaid has to reimburse doulas. I did lead a Medicaid doula pilot in the state of Georgia in 2022, and that pilot was able to support 175 families with free doula support. And how we were able to do that was through having Medicaid insurers provide us with the funds to reimburse the doulas. Reimbursement rate was at $750, which was still, even in 2022, very low. However, it was something, and a lot of the doulas that were a part of that program, we had over 40 doulas. A lot of those doulas had never even been paid for a birth that they supported before, right? But some of the things that came out of that were there was they didn't even have gas, right? Sometimes to get to birth. So I was like, we need gas cards. So I was able to get a little bit of funding and we could give them gas cards. But even then, there were still significant barriers to them providing the support that they needed because the reimbursement was just not enough. From there, we were able to, from the findings from that pilot, we were able to say that doulas in Georgia needed to be reimbursed at least $1,500 per birth. And so now, across the state, across the country, there's a reimbursement rate for doulas of $3,000. Shout out to Washington State. They were able to get reimbursement at $3,500 for doulas. And so we were like, in Georgia, we're going to ask for 3,000 and we'll see where we land. But we are working on heavily advocating for reimbursement from Medicaid for doulas in the state of Georgia. Right now, community health workers are a really big deal. We don't even have reimbursement for barely have reimbursement for our community health workers in Georgia. So that is the focus that our health committee is working on. And so, as a workaround, I'm a very ambitious person. I would like for reimbursement to start happening in the next year for doulas. So as a workaround, we are going to target those Medicaid providers again to get the funds to be able to do that, because our providers are changing. I think this is happening across the country, that the Medicaid providers that have been in place now are actually changing. So we're going to have, I think, 5 or 6 new Medicaid providers in Georgia come July 20 or maybe early spring 2026. And all of those organizations, such as CareSource and United Healthcare, they all have clauses that they provide reimbursement for doulas. So we're going to go directly to them and see if they're going to provide us with the funding to go ahead and reimburse doulas. And I think that that's going to really speak to the legislation and how they need to just go ahead and, on a state level, since the providers want to go ahead and put Medicaid in the state fiscal budget. So that is how we are advocating for livable wages. Beyond that, when doulas are working for these community-based organizations, we are asking that they pay doulas at least $52,000 a year. So great job. I loved when I worked at Healthy Mothers, Healthy Babies, but when I came in, because I was technically an entry level and I did have lots of corporate experience prior to, but I was just a doula. So I came in making $42,000 a year, right? And it was very low for the work that I was doing. Again, I was advocacy, policy, research, evaluation, so many things that a lot of times, and this was not just unique to me, you find that a lot of doulas are doing when they're working for these organizations, because we are experts in maternal health. And we a lot of times very innovative, have great ideas around programming and things like that. And you find that we're not respected professionally because it's a holistic practice and there's still not a lot of information around, the efficacy of doulas, at least so they say. There are a lot of studies, but just things that make organizations feel like it's not advantageous to pay doulas at the rate that they're paying other employees. And so that was something that I helped to grow the budget significantly. And I said, this is how much I have to be paid. And then we need 5 staff doulas and they have to be paid $50,000 when they come in the door. And they need insurance, they need benefits, and they need to be able to have a space to decompress. And they don't need to be case managers and do case management as well. So there's also a huge advocacy around how community-based organizations and health federal organizations like your Department of Health and things like that incorporate doulas into the workforce. And we do have a advocacy on that salary amount. And then we want to integrate doulas into our healthcare systems. So healthcare systems have funds; they get funding on their own to be able to hire different employees. And with the maternal health system that we have in Georgia being so poor, it's advantageous and supportive for hospitals to go ahead and integrate doulas and pay them. We do have one hospital system in our state that does pay doulas at a sustainable and livable salary, and they provide benefits. They provide. I just found out that they're doing what do they call it? When you get your school tuition reimbursement and all of those things. So we want to make sure that other hospital systems, when doulas are integrated, are also providing that same kind of infrastructure. Um, Comprehensive support. So we talked about this a little bit for doulas. We want them to have access free, either barrier free or low cost access to CEUs, mentorship, and culturally grounded training, policy to improve systemic barriers, preservation of traditional ancestral knowledge, and then holistic wellness activities for doulas. I think that part is most important, and the part that I'm really the most happy about that we're going to do as an organization is to be able to provide spaces for doulas to have wellness activities and holistic, you know, spaces and emotional, mental health, well-being, and development. And so that is something that we're emphasizing because, again, it is really important that doulas have this support because, again, the burnout, the mental health challenges, all of the things are very real for birth workers. Some of our successes and best practices. So, successes, we've done a really great job on building awareness and building relationships, strategic partnerships across the state, across the country, engaging the community, fund development. We are actively and aggressively fundraising right now, and we do have a lot of good traction on that. Being recognized by the state. All the other MCH organizations are now, coming to us about, so what do we need to do for doulas? How do we get doulas integrated into our systems? We've been contacted by several healthcare systems in the state to be able to come and provide education around what doulas are, what they do, and how they can be integrated into their healthcare systems, especially in the rural areas, which is another main target of ours, because in rural Georgia, there is very little access to good maternal health providers and so many other things. Best practices. It's really good to involve doulas in anything that you're doing as far as policy wise. If you want to do anything with doulas, go to doulas and bring them into that conversation. Community collaboration. Same with the community. Make sure you're hearing from the community members, hearing from the moms, the families about their challenges, what they're experiencing. Because sometimes at these organizations, we can be so far away from what's actually happening with people who need our support. And again, that whole savior thing, right? We think we have an idea of what would be best for people, but it's good to just ask them what they need, right? Meeting people where they are. Rural engagement, again, as I was just mentioning, it's really important to make sure to, engage our rural communities because they are struggling just as much as your traditional, typical marginalized people, which we like to, just bucket that by race and class. People who live in rural communities are a marginalized group. And then other stakeholder investment outside of maternal and child health. So we've been engaging in the tech community, the tech space, private sector, and things like that, because everyone has a mother. And maternal health is important to everyone. So it's important to involve all parties in maternal and child health work, especially for doulas. And then recommendations, funding doula support infrastructure, not just the births. So a lot of times funding is provided from organizations or from funders to just support the births of the families, right? And it's not for the advancement of doulas or the infrastructure to build up the workforce. So when you're seeking funding for your organization or you're wanting to get funding for doula stuff, you have to make sure that you're doing it asking for that infrastructure funding as well. We want to respect and uplift traditional doula practice and knowledge. We talked about that before, including doulas at decision-making tables, centering their well-being, involving diverse stakeholders, and then ensuring partnership and collaboration with the insurers. I think that's really important as well. And then our future plans and next steps. We want to continue to expand doula advocacy for doula insurance reimbursement, professionalism and recognition. We want doulas to be recognized as essential professionals and a part of the maternal healthcare team. We are a statewide doula hub and want to continue to be that and grow that out. Um, Again, the doula well-being, advancement, and sustainability, integrating doulas into healthcare systems across Georgia. By the end of this, we want to make sure that all healthcare systems and hospitals in Georgia have doulas available. Whatever that's going to look like for that healthcare system, we will figure that out as we go, but we want to make sure that they all have are able to provide the community with access to doulas. And then we want to continue to be a state and Southeast regional convener for other community-based and doula organizations and those who are reimbursing or support the reimbursement of Medicaid and private insurance reimbursement for doulas. And that is all I had. If yes, and this is our information. Thank you.
Thank you, Chanel. That is more than all I have. You have shared so many gems that I was over here diligently writing down everything that you have been saying, um, just to capture some of the things to repeat back to you. So thank you. And still, I have not forgotten. Happy birthday to your baby and your mama. So I appreciate you spending some time with us this afternoon as we transition into Q&A at this time. I'm
Thank you.
waiting
That's
for
why I'm
the
all over the place because we're
No, you're not over the place. Listen, I'm gonna hit you up for my podcast. Um, listen, I got a long vision board behind me, you all. So let's jump right into some of this Q&A. First of all, I'm gonna be quoting y'all somewhere one day because I was just diligently taking notes. I'm gonna start from the bottom up because there's been so much love in the chat. I hope you all are seeing that for both Brandie, Chanel, as well as Dr. Hutchinson. A lot of your words have been resonating with our audience. So I just want to start and honor and lift that up first. Um, so Chanel, one of the things that came in, um, Sister Chanel, you talked a lot about hospital system doula integrations, that it comes with a lot, but at what cost? If we're fighting the fight for midwifery, what's the culture and humane conditions a hospital setting should use for upholding maternal health and liberation for birthing people and care workers? So I'm gonna repeat it because it was a mouthful.
please.
Um, And so really you mentioned the cost, right, of hospital system doula integration, and like it comes with a lot. And it was a rhetorical question, but like at what cost for us as care workers, as folks in community?
So let's
And
let's break it. Let's break it into
yep,
parts. Can I answer this part first? So
yes.
I get this question all the time. And if you ask me, so I like to share this story as well. When I came into this work at first, I was like, I'm gonna fight the man, right? And so I wanted to dismantle the system quickly and all the things. And what I realized is that we're all fighting the man, right? The systems that we're integrated into are the man. And with that being said, most births are still happening in the hospital. Most people are having, their babies in the hospital. You don't have a lot of home birth happening still. Like it's increasing, but it's still not the main place to give birth. You still have a lot of people who aren't comfortable with giving birth in the hospital. You have a
Hmm.
country full of sick people as well, right? So you still have a
Hmm.
lot of high risk pregnancy. So birth is going to continue to happen in the hospital. Doulas need to be there, right? So we have to figure out how to integrate ourselves into the system and navigate the system in a way that is not that we are coming in to be a part of the system, but we are coming in to support the families as a family advocate and liaison in a system that they have to navigate that we know more about, right? Like we understand what that landscape is. We understand how they can speak up for themselves. We teach our clients how to advocate for themselves. So it only makes sense that we're there. And I hate to use this language because this is exactly who they think we are. Anyway, off topic, I went to a conference one time with hospital providers, and they there was a lawyer that they had there that was saying that doulas are like there to just kind of like spy on the providers and then like go in and tell the clients to sue them. It's not necessarily the case. However, we are kind of in a way like a whistleblower in the space, right? If we're not keeping our eyes on what's happening, we totally miss how to be able to provide the education that clients need to be able to
Mhm.
support themselves, right? So it's all about the informed decision making around it. And I'll take the next part.
And the last part was around, I feel like you answered it, upholding maternal health and liberation for birthing people and care workers. I feel like you covered that in your response.
Yeah, yeah.
I'm scrolling along here. Both of you, I'm curious to hear about your different perspectives or advice on this. You mentioned the saviorism complex in different ways. Brandie, you talked about it as a doula and like preventing burnout and being in community with other people. And Chanel, you talked about it. Like, what does that mean for birth workers? So the question in here around is as we sit with the saviorism complex for a minute, because we're all in different ways navigating that, how are you all addressing it? Like, what are the key strategies? How do you check yourself and maintain your own boundary with the saviorism complex as a care worker, as well as take care of that in terms of supporting your clients?
Yeah. And
I
so I
know.
think in general, right, it's important, and me and Chanel, I think both really talked about this, is that as a doula, we get very invested. This work is very spiritual. This work is very ancestral. It is very impossible to get into this space and not be somebody that's giving a lot of yourself. But like I mentioned earlier, as a doula, I find that while we talk a lot about what this space does as far as advocacy for others, especially our birth workers, there is a lot to be said about what being a doula does for you personally. And I think that in general, one of the ways that in training and mentorship with other doulas that I try to address this is making sure, similar to Chanel and similar to the program our doctor was talking about earlier, it is important that we address our own personal, right, traumas, biases, things that make it so that we might not be able to show up fully for our clients the way that we need to. And that's a personal thing, right? That means that we have to check where we are and who we are at the door. And it's important to do that very early on as a doula, right? Because oftentimes, and this is not saying anything ill against doulas, that we are in that growing pattern, right? We come into the space oftentimes thinking we're the saviors, right? Unfortunately, society is saying that. People around us might be saying that, oh, the doulas are the savior. And so to find longevity in this space, you have to quickly realize that that's just not true. I am here as a tool, right? I should be educating, I should be supporting, I should be advocating for. I'm never taking the voice of my client, right? I'm never taking on all of their dreams and their wishes because this is their birthing experience. And I think that while we do that in a way that we do truly believe we're being sympathetic and empathetic, oftentimes we take away the journey from our doula, I mean, from our clients when we show up as a doula who's trying to, or maybe not doing a great job of trying not to intervene on their birth scenario. And so, in a general sense, and I think this is great for being a doula, but also just as a business person, you got to set those boundaries. And the thing that I stress the most is boundaries make us all better, right? Boundaries sound like such a bad word in the birth work space. Like, oh, I need boundaries. Oh, that means you don't want to help. Like, that's not what that means. I want to help efficiently and effectively, right? Having boundaries does not make you a bad doula. Having boundaries makes you a better doula. If I am showing up for 4 different births, I want to make sure that I can show up for all 4 births, right? In a way, like Chanel said, that make sure that I'm giving a holistic approach for every client that I come into contact with. And that is just not possible if I'm pouring from an empty cup. And so that boundary, I think that we just, in general, I don't think there's any way around it. We just got to stop making it a bad word. We need boundaries in birth work. I think that it makes us all better. And it also, for me, the reason why I am so big on it is because I've seen the benefit of it, right? And I'm sure Chanel can say from her practice as well, as a doula, it's important that you do not set families up for failure, meaning that one day you cannot be there. I love my clients. I love birthday, first birthday cards. I love first Christmases. I love being invited to birthday party. That's my favorite. It's all the feels, right? But it's also a boundary there where they understand I am here for a season and I am here for a reason. But at some point, you will have to be able to do this with the team of people that are in your life. Meaning that I should be here as a coach. I should be helping you set the play, but I should never put myself so involved in it that if I walk away, that this thing cannot stand on its own. And I think that if you, as a doula, look at yourself in that respect, it helps. And I do think that that will negate, maybe not eliminate fully, but definitely negate some of that savior mentality.
Thank you. Chanel, is there anything you want to add?
No, every single thing she said, everything she said.
Yeah.
Perfect. So this is going to be our last question. I know it goes really fast, and I could stay on here for another hour talking with both of you, truthfully. Um, I want to end with this question. Since our theme was around really self-care and prioritizing that for doulas, share one thing each of you do in your work in the birth space to, one, keep your joy cup full, because we are
Mhm.
navigating some tumultuous times, and
Mhm.
or take care of yourself. Leave us with that as I get ready to close us out.
Chanel, you want to go first? You want me to?
I'm gonna
Chanel
go
might should
first.
go last. Mine's a little controversial, y'all.
Okay, okay.
It's
We'll
just
let
a little
Chanel answer
controversial.
my final question and then I'll close us out. Go
Go
ahead.
ahead,
Just
sis.
because I feel Chanel is very much like a pillar of this community. Even before I became the MBDA owner, I remember meeting Chanel just out in the community, and I believe that as a birth worker, when you think about community and you think about people who like literally dedicate their lives to that connection, that's something that Chanel embodies, right? And it is so important that we have these kind of pillars within our community. It just is. I'll say that mine is a little controversial just because I am very, very, and not to say Chanel isn't, right? Just my lens. Oftentimes people are like, Brandie's very much about the money, right? I'm about the money because
Come on, tell us.
money allows us to live the life that we need to live to show up fully for these families, right? I'm a person, and just to give you a very small snippet of my story, I grew up in a single parent household, absolutely love my mother, but she had some mental health issues that made it so she could not show up fully as a mother. So when I was 18, I adopted my sister, who was 8 at the time. And so birth work allowed me to not only raise my sister with finances, like to be able to pay our bills, but also to put her through college with no debt. So when I talk about birth work, I do it from the vantage point of how I can help families, but I also do it from the vantage point of how it's helped me, how birth work has given back to me in my life. And so I look at what doulas need and what they, especially for sustainability and longevity, because a lot of the doulas that I meet, they have families, they got
That's
little
right.
ones of their
That's
own that they're
right.
sacrificing time away from their spouses, away from their family to show up for births at 3, 4 o'clock in the morning, right?
Mm-hmm.
So to me, the best way to take care of somebody who's willing to sacrifice that much is to make sure they're well compensated. I tell people all the time that as a doula, there's nothing like me showing up to a birth after I went and got my hair done, my nails done, or went to get a massage or slept in one day, right? I am a better doula when I can do that, right? Because I'm
That's
taking care
right.
of me and I have the ability to take care of me, right? So I think that showing up as a birth worker is already intense. But when you do so from a place of, I didn't even get a chance to pay my bills, now I have to wake up at 3 o'clock in the morning and attend a birth for somebody who might not even be able to compensate me for the time that I'm spending here. That's hard.
Yep.
It makes birth work harder when you can't navigate your own personal finances, right? And so I don't say that because I think that you should only, because you can never, I promise you, if you're in this space for the money, you will leave quickly, right? But if you're in this space, you should be reimbursed. You should be able to have a lifestyle that says, I can be the mother, the partner, whoever I want to be in my personal life and show up. Because I promise you, doctors, lawyers, teachers, they don't have to say, well, do I pay my bills or do I use this gas money to show up to a birth?
Yeah,
Those are
I
not
know.
questions that they have to think of, right? So to me, again, birth work is a very spiritual, very beautiful place, but the sacrifice is tangible, meaning that if I'm showing up for a birth, I got bills to pay. And the best way to take care of me is to make sure those bills are paid. So when you're working as a birth worker, one of the things that I tell people across the board, if you're doing so in an entrepreneurial stance, you got to make sure your business is in order. Me taking time to do my paperwork days or how I take care of me, because if my paperwork is done, if my business is set,
Mhm.
I know that finances can continue to flow. And then if I have a hard birth and I need to recover and I need a massage, I don't have to feel bad about that.
Thank you, Brandie. No, I echo that. I believe that doulas, as Chanel said earlier, should be thriving.
Mhm.
Forget equitable wage, like I love that. And Chanel, you're one quick, because we got to let the people go. Way that you fill up your own cup with joy.
Yes, thank you so much, Brandie. I didn't expect my birthday, my kid's birthday, always emotional, I always cry. So I guess that was my cry for the day. Thank you. Thank
You
you.
need all the flowers, Chanel.
All of them.
As a pillar of the community, something that I didn't even recognize or have not recognized even about myself or the work that I do. I just do it because I love it so much. I am just learning how to take care of myself and how to pour
Hmm.
into myself. I have three children. They're 15, 10, and 6. I have, I'm the oldest sister. I'm so much for a lot of people. I just do whatever the F I want. And I was gonna cuss, but
Period.
I usually, I like to keep it community, but it's professional. But I do whatever I want these days. And that has been so fulfilling. And I always center joy. My spiritual practices have been really strong recently because that is so important to be spiritually grounded, especially in this spiritual work. And because all of this will show up as a mirror for the birth workers that are on here. If you're not
Mhm.
together, it is going to mirror in the clients that you get and the way that this work shows up for
Yes.
you, and it'll seem so messy, and then it'll add to the stress that you already have. And like Brandie said, my sustainability right now is so important. Like
Mhm.
I did not ever come into this work and do not do this work because I want to be paid. And I actually frown on it a little bit when people are like, I'm trying to make money. It's like that's not going to get you. But once you've put in a certain skin and you've done a certain amount of work, you start to
Mhm.
realize how essentially important it is for doulas to be paid thriving,
Mhm.
livable, sustainable wages. And that's the throne that I sit on. And so, yeah, give me some money and I'll be happy any day.
Listen, I'm always playing a Powerball. Those in Massachusetts know I always say if I hit, I got a list of organizations over here on my vision board.
I
But with
love
that
it.
being
Thank
said,
you.
I want
And
to,
that, because then we can pour, that is that too,
that's
right?
it.
When we pour out, those of us who do this work, when we pour out, we feel so much better. So if we have
Mhm.
more, we can give more. So
That's
that's,
right.
thank you. Thank you for saying that.
No, no worries. All right, you all. Thank you both for your time. There's a webinar poll that has popped up. Again, I can't thank you just doesn't even feel like the right words. I feel like you all have left such powerful gems, not just for me and the work that I'm doing. It's such an honor to be able to curate and have you all share your wisdom here at Health Lead. So thank you, thank you. Fill out your poll. Our next webinar series will be on October 15th. You'll get information about that. There are links in the chat. All I can say is thank you. I'm sure I probably forgot something else. But please do that post evaluation survey, and I look forward to seeing you all in October for our final session of this year of this webinar series, in which we'll be focusing on expanding doula access. Have a wonderful rest of your day. And if your friends missed this webinar, be sure to share the recording and support materials with them. Thank you again, Brandie. Thank you, Chanel. And thank you, Dr. Hutchinson. Have a great afternoon, everyone.